Hi, my name is Dr. Michael Lee. You've heard me talk about what I do. Now let me tell you why I do it. When I met my wife, she was sick. She thought she was normal, but she was sick. At age 3, she said she was told that she has asthma. You can never exercise without your inhaler. And she started to develop into some allergies. So then she had to go to the allergist, get all those shots and do all that stuff. And she was just told that that was part of her normal routine. Then, as she started to grow older, she started to experience some changes in her body. And she noticed that her cycle was every 2 weeks or every 2 months. It was very irregular. And then, as she started to mature a little bit more, she realized that she was having some excess hair growth, maybe where she didn't want it. So, as we got married, she was sick. I mean, I would get done in the morning and I would shave, and she would borrow my razor. And I said, Lauren, I love you, but that's not normal. You have something going on in your body that's not working the right way, because not everybody's dealing with this. So I know that there's something going on inside of your body. And I'm in chiropractic school, and I said, you've done the drugs, you've gone the medical route. Let's try something different. So I'm in chiropractic school, and I'm trying all these different techniques. I learn something, go to a seminar, I learn something, I come back, I try it on her. I start taking acupuncture classes. I mean, I was doing everything I possibly could to help her body start to heal, because it was obvious that it was not functioning the right way. She saw a functional medicine doctor and got some blood work. Oh, yeah, she had a bunch of stuff going on: thyroid issues, female hormone issues. The OBGYN said, oh, you have a polycystic ovarian syndrome. You have an ovary on your right cyst. It's going to be really hard to get pregnant. And we were kind of stuck until we met a doctor, moved to bone in her neck, talked about nervous system function, and we started to see her life change. About a year into care, we really started to see some changes. She didn't have to shave as often. The excess hair was starting to not be as excessive. Her cycle was on a pretty consistent basis. She ran a half marathon and forgot to have her inhaler. Why? Because having an inhaler is not normal. Fast forward a little bit longer, we had a baby. All of these things she was told that would not happen. Just take this medication. You see, that doctor moved to bone in her neck was an upper cervical chiropractor, and he wasn't adjusting the thyroid bone or the excess hair bone or the female menstrual bone or the polycystic ovarian bone or the asthma bone. He talked about nervous system function, normalizing that nerve supply from the brain through the brainstem to the rest of the body. And as I started to see these changes happen in her life, I said, I have to study this and I have to learn this so that other people like you, Lauren, that are struggling in their health and they don't know what else to do, they've lost all hope, they've tried everything else, I can give them hope. And that's why I'm so passionate about doing what it is that I do, because so many people have not heard this message. I always say that life needs no assistance, just no interference to its functioning. I mean, it's just amazing to see when the body has this optimal environment to start to heal, lives transform. I've seen it. It's just amazing when it's in the proper environment. And there's really three main things that can cause this environment to not be optimal. It could be psychological stressors, it could be physical stressors, or it could be chemical stressors, or a combination of the three. And so that's why I'm really into the thoughts, the traumas, and the toxins, and helping people achieve their health care goals. And I can't tell them what their goals are, because everybody's a little bit different. We all look different on the outside. We all look different on the inside. Everybody has a different goal. And so that's why I'm so intentional about sitting down with people and learning what their goal is, so I can partner with them to be the best version of themselves. If it can work for my wife, it can definitely work for you. And that's why I'm so passionate about what it is I do as an upper cervical chiropractor.